Topic: Behavioral change. Introduction. This exploration emphasizes recognizing the importance of seeking timely medical help when behavioral changes occur in yourself or loved ones. Prompt attention to behavioral changes is crucial for well-being. Step 1. Understanding behavioral changes. Behavioral changes cover a range of actions, emotions, and social shifts. They can manifest as mood swings, social withdrawal, sleep disruptions, appetite changes, and energy variations. Step 2. Recognizing warning signs. Signs like mood swings, isolation, sleep issues, appetite changes, cognitive decline, substance abuse, and unusual behavior may hint at underlying issues. Step T. The right time to seek medical help. Early intervention is key. It allows for early diagnosis, prevention of escalation, better quality of life, safety, reduced stigma, chronic condition management, and improved relationships. Step 3. Who to consult. Choose healthcare professionals based on the nature of changes: primary care physician, mental health specialist, neurologist, substance abuse counselor, or family therapist. Step 4. The consequences of delaying care. Delaying care may worsen symptoms, strain relationships, affect work and education, pose self-harm risks, lead to financial and legal problems, miss personal growth opportunities, and strain family. Step 5. The role of support. Family and friend support is vital. Encourage open communication, express concern without judgment, and offer help in seeking treatment. Conclusion. Seek medical help promptly when behavioral changes arise. Early attention can lead to early diagnosis, prevent issues, enhance quality of life, and reduce potential consequences. Your proactive approach is key to a healthier, happier life and successful recovery. If you found this content valuable, hit the like, share, follow button and spread the knowledge to help others. Sharing is caring.